I had the tooth removed in last summer. It was a bit inconvenient because I always had to chew on the other side, and I thought, gosh, if anything happens to the other side of my mouth, I'm in real trouble now. And then 2 or 3 months later, I had the actual implant tooth put in. It was quite well explained what was going to happen to me and how long it would take. And so there wasn't anything that I didn't feel comfortable with. It's a very friendly, smiley, there's no tension. I think that's really quite important, especially if you're a bit worked up about it. I'm not too bad on that front, but I know people that get very worked up when they go to the dentist. But you don't get that sense. It's just, oh hi, informal, relaxed. You think, well, if everybody's this relaxed, it can't be that much to worry about, can there? So, and Helen, the hygienist, we have a good laugh because we've got lots of animal things in common. So it's difficult to talk when you've got your mouth open and someone's trying to do your teeth, but we manage it.